My name is Cortland Lee, and this is my presentation on hypothermia. Hypothermia is defined as a decrease in core body temperature starting at 95 degrees Fahrenheit, owing to inadequate thermogenesis and/or excess environmental cold stress, sometimes referred to as accidental hypothermia, to distinguish it between the therapeutic or induced hypothermia used for cardiac reasons. The definition is somewhat arbitrary because the pathophysiological symptoms can begin at higher than 95 degrees Fahrenheit. Pathophysiology. The body regulates cold stress by increasing thermogenesis, or the production of heat in the body, decreasing thermolysis, the liberation of heat from the body, and pursuing adaptive behaviors such as vasoconstriction. If cold continues, vasoconstriction is lost, and then vasodilation occurs with the loss of core body heat to the periphery. Risk factors. People at risk have increased thermolysis, decreased thermogenesis, and impaired thermoregulation, and also other contributing factors. Cold temperatures, fatigue, improper gear, wetness, dehydration, malnutrition, length of exposure, and intensity of weather are all issues that can lead to hypothermia. Risk factors. Alcohol. Impaired shivering thermogenesis is caused by alcohol. It promotes cutaneous vasodilation, liver disease, which leads to decreased glycogen stores, and the malnutrition of most alcoholics further impairs the metabolic heat generation. It also impairs judgment, which can lead to staying out in cold longer than you should. Risk factors for geriatrics. Older patients have reduced muscle mass and diminished shivering response. Atrophy of subcutaneous fat cells produces insulation. Medications commonly prescribed may interfere with vasoconstriction. Hypothyroidism and malnutrition. Risk factors for trauma. Hypotension and hypovolemia may interfere with normal thermoregulation. Central nervous system trauma, shock, and burns will not be able to mount a shivering response due to their injuries. Hypothermia can lead to a decreased coagulation and acidosis. Assessment. One assessment tool for the early signs of hypothermia is the umbles: stumbles, mumbles, fumbles, and grumbles. These behaviors are good indicators of how the cold affects cognitive function in the early stages. Mild hypothermia is defined as 95 degrees Fahrenheit to 90 degrees Fahrenheit. Moderate hypothermia is defined as 90 degrees Fahrenheit to 82 degrees Fahrenheit. Severe hypothermia is described as below 82 degrees Fahrenheit. Signs and symptoms can be present before dropping to 95 degrees Fahrenheit, and the body uses those to regulate temperature. Hypothermia may also be defined as acute, which has a rapid onset, such as a submersion in cold water, subacute, short period of time, and chronic occurs over days, such as a geriatric patient in a nursing home with cold temperatures. The overall effects of hypothermia on the body is to slow down, but the different body systems react in different ways, which will be covered in the next few slides. Assessment with the central nervous system. Slowing down response is most seen in the central nervous system, where just about everything slows. Thinking, feeling, and speaking are all slowed down. Apathetic. Some patients may present with apathetic and impaired reasoning ability, speech slowed and slurred, coordination impaired, and the gait is ataxic. These symptoms are all also relatively close to the signs and symptoms of a stroke, so a good differential diagnosis is needed. Assessment for the cardiovascular system. Peripheral vasoconstriction shunts blood to the core. The sodium reabsorption mechanism becomes impaired, leading to an increase in urine output, also known as cold diuresis. Cooling of the tissue induces a flow of water from the intravascular to the extravascular spaces to increase the viscosity of the blood. Cold initially speeds up the heart, but then slows down and disrupts the electrical conduction. At a core body temperature of 90 degrees Fahrenheit, the heart experiences dysrhythmias, including atrial fibrillation. A unique Osborn wave may be observed, as shown on the next slide. Of special concern is ventricular fibrillation, to which a hypothermic heart becomes susceptible at a core body temperature of 82.4 degrees Fahrenheit. The AHA, CPR, ECC, and ACLS guidelines suggest attempting defibrillation once. If VFib persists, the advice and evidence is unclear, and treatment may include repeated attempts along with rewarming measures. The respiratory system. The respiratory rate speeds up, and then it slows down, leading to decreased minute volume. Tracheobronchial secretions increase. Bronchospasm may occur. Non-cardiac pulmonary edema may also occur. At 90 degrees Fahrenheit, hypoventilation is profound, protective airway reflexes decline, and O2 consumption decreases by about half. Assessment of the muscular system. Shivering is the initial response and the body's best way of thermogenesis. Shivering ceases around 91 degrees Fahrenheit. Cold muscles become progressively weaker and stiffer, impairing the person's ability to save themselves. Assessment of metabolism. Shivering can deplete the body of glucose, leading to hypoglycemia. Insulin levels fall, making further glucose use impossible. Body switches to the metabolism of fat. Liver metabolism is slowed, making the effects of drugs last longer. Warm sugar drinks are given to meet the caloric demands of shivering.